Thank you, BW Business World, for having us here. It's a wonderful houseful, since morning, and very interesting discussions which are happening. And to take it further, I have a very fantastic panel with me, and they are from diverse areas. But the facility management is the most important discussion what we are going to talk, and the security and the safety part, the public safety, is something which we cannot ignore, right? It has been part of the overall technology shift what we are seeing. We are seeing the plain vanilla facility which were there or how it was being handled. It's changed from a smart facilities. Right? When I say smart, we have the HVACs which are connected. We have the smart building which is there. We have got the building management system. We have the visitor management system. We have the space management system. Right? So all those put together, it's making a thing which is more complex, which is more interesting, and primarily a bit difficult to handle to begin with because we are not aligned to that kind of shift. So it's very important to understand how this technology which is being coming in as a part of the facility management now could lead to challenges also, and it also gives you the safety aspects which are important, also the cyber security aspect, because cyber threats are also part of the facility now. Think your building getting cyber attacked from one of the bulb which is there. It had a Bluetooth connectivity, and it gets the complete building is hacked from there. It's all possible. People have already faced that kind of thing. So I will start my discussion with the panel. We'll try to keep it very simple so that you all understand that. So what are the primary concerns which we see on the public safety and the security part of it? So one question which I'll relate with all my panelists and start from there. So sir, you can start with it and your views on the subject and your experiences. How do you look at it, sir?
Good afternoon, ladies and gentlemen. First of all, thank you, Business World, for this opportunity for us to sit down here and discuss. We've had some very interesting topics in the morning. Samir gave us some inputs on that. Then we had Rupal also there. And the last one, of course, was on ESG. So, I mean, just picking up the dots from there, basically our topic is today on public safety. So, whenever we come up with such, there are various factors actually. So we can start with the factor that the first factor is an access control wherever we are. Whichever premises we enter, there has to be some sort of an access control. The pros of it is that you have a controlled system. The con is that, a lot of times if the system is not integrated properly, people coming into the system do face a lot of problems in that. Moving on to the major facilities that we have, all the facilities are all in. Today we don't talk of standalone systems. Everything is integrated with each other, whether it is the HVAC system, whether it is your biometrics again, or whether it is your entry system or even your cafeteria management. So all these systems are integrated with each other. There are accesses to it, and as well as there are a lot of hurdles also which happen into it. Every facility for different verticals has a different problem. I come from a fintech background, so we have various other problems which we will discuss down the line. So just to pass it on to my next colleague so that he can take it forward.
Yeah. Over to you, Jeetendra. Thank you very much, sir. Very insightful things, and access control, which we take as part of the security now, but it's very much part of the facility management, and also you seeing all the facial recognition and linked with the access control. It's always a challenge of data security. We'll talk of that as well. But Jeetendra, over to you. You from the healthcare, you have a different set of challenges and different set of solutions to it and standards to follow. So over to you on your views on it.
Thank you. Colonel Saab, since Captain Collaco has already mentioned one of the threat security challenges that facility managers face, I would like to add 4 more challenges to it. Okay, security challenges. So second one is the violence. I'll keep my inputs in general to healthcare sector and particularly to healthcare facility management. So considering that, the violence to the medical and paramedical staff is one of the security challenges. The third one is the theft. Of course, when you get into a healthcare facility, you are not in right frame of mind. Environment is quite stressful. Although healthcare facilities are working pretty hard to ensure that your experience is always pleasant, but the kind of unpleasant thing that you are going through your life when you are into a healthcare facility, you tend to forget things. So naturally, a lot of things are misplaced. At times, we have found internal staff carrying out thefts, visitors and patient attendant getting involved in thefts of another colleague or patient attendant property. The third one is, fourth one is the insider threat. Imagine your healthcare data, your health data getting into the hands of people who can use it to their advantage. Okay. One example I'll give, 75 years back, the private doctor of Muhammad Ali Jinnah knew that he's suffering from a tumor in his lungs. There was a tennis-size tumor in his lungs. Just imagine the consequences of that medical data getting out. Probably the history of this subcontinent would have been different. Just imagine. So on that note, ensuring the patient data safety from the insider threat is one of the challenges. And last but not the least, it is the second biggest challenge: natural and man-made disasters, including fire, flooding. We have seen, in last 11 or 12 years, we have seen one of the hospital in eastern part of our country getting burned, leading to 107 patient and staff casualty. I'm talking about AMRI fire, which happened in Calcutta in 2011, 3rd December to be precise. And in last decade or so, the Chennai floods. So, half of the hospital of Chennai city were actually underwater. Their floors were underwater, and there's, the design of building is such that there's, that their transformer, their panels, they were all in basement. Their pharmacy, their supplies were in basement floor. And that, kind of defunct the hospital. So these are 5 challenges, security challenges that we face.
Yeah, you touched upon very important point of the insider threat, and just to tell you, most of the challenges which facility manager faces today is the insider, and it's more than 70 to 75% of chances that the data will go out, and that's very critical data, and that we call today in the parlance is the data privacy, and to be managed in a very pragmatic manner. So we have Ashish, who again brings in lots of experience into this particular fields, and your views, Ashish.
First of all, sir, I would like to deviate a bit. I would like to recognize the efforts by all the facility managers and the leaders who are sitting here. In my 2 decades of experience, I have never heard facility managers saying no to anything. And this reminds me of one very interesting story from my military days. Almost 2 decades back, in military there is a regiment called Sikh regiment. And whenever, I'm sure all those who are from the military background, they will agree with me. Whenever you tell them anything, even if it is completely unimaginable, their first answer would be, "Ho jaoga saab." And one of the incident is, 2 decades back, I was posted on Punjab border, and we had this Sikh regiment with us. And there was this, the Pakistani Rangers, they are equivalent to our BSF border security force. And there was one guy who constantly used to come on the border, and he used to, abuse, completely drunk, and used to go back to his side. So I got irritated one day and I said that, yeah, we have to take care of this person someday. And this Sikh Subedar from Sikh regiment, he says, "Ho jaoga saab." And I thought he just said, and I forgot it. In the evening, I found the JCO comes and he salutes me, and he shows that person. They went and picked up that guy in the winters and brought it in our post. So, ladies and gentlemen, first of all, let's clap for the Sikh regiment of corporate. facility managers. Now coming back to the question which sir was asking, there were a couple of things. How many of us are fond of Charlie Chaplin? I'm sure all of us have seen. It is 50, 60 years back. And in Charlie Chaplin, one of the episode which I remember is that Charlie Chaplin is working in a plant and he's made the guinea pig, wherein the engineer who develops a butler who automatically feeds you with different dishes, and he's made to sit on the table, and that machine starts working. It starts serving different dishes, and suddenly something goes wonky in the machine, and it starts so fast started feeding that it goes out of control. I was just imagining in today's time of convergence, which is one of the most talked about area wherein OT and IT are constantly talking about. Those days, 15, 16 years back, those people who have actually designed or developed that machine or Charlie Chaplin movie, they have realized that that kind of time will come. In today's time, when the IT and OT is converging, we are constantly creating loads and loads of data. There was one incident wherein we were in UK carrying out an audit and assessment of one of the county, wherein they have developed one safety and security solution. It was a complete full life-size robot. And the citizen walks up to it, and if they are facing any problem in the community, let's say, for example, filing an FIR, so you just go and narrate your incident and it records and it automatically sends the emergency response team to take care of that particular incident. Now, suddenly what happens is that these people, whenever they were going to register any, let's say, something goes wrong with your drainage system in the city or something, anything which a common citizen faces. And when they used to go, it started laughing. So people were, answerless, and we were carrying out all the kinds of assessments, VAPT, possibility of hacking, etc. But you won't believe there was just small cleaning by the facility guy, which took care of that particular issue, because there is a concept called Henlon's razor. In that, what happens is that majority of the time, we give undue weightage to the worst possible scenario and avoid focusing on the basic minimum. That is one. Second is the resiliency. In COVID-19, I'm sure we all have agreed and we all have seen the disruptions different scenarios can create for us. And facility managers are one of the key contributors in preparation against resilience. So these are the two areas which
Thanks. Resilience is the key, because anytime there's a challenge, incident response is the most important. So, most of the companies, they want to embrace the newer technology. They want to make everything smart. But there's always a constraint of budgets. They have a constraint of the will to do it at times. So how do they really leverage on the technology for making the public safety and security as their main key area in the coming time? So that's very important thing to, ponder on. And my question to my panelists is that how do they really leverage the technology? How do they really work on imbibing the newer set of smart solutions as a facility managers to make the things smarter?
Well, Inderjeet, the emerging technologies or the importance of technology is undoubtedly one of the best things that could ever have happened to us as on date. Since I come from a fintech background, so I can just tell you that for us, product and tech work hand in hand. So we always try to develop new products, and that is always based or backed up by the technology. Now, on one hand, you have technology and you're moving at breakneck speed with the technology here. But of course, there are downsides to it also. Now, how do you really manage that sort of a data? Of course, you have data privacy laws, but the only problem with the data privacy law is that you don't have a common platform for all these things. No, you have different platforms. The EU has a different platform. We are following a different something else. GDPR says something else. So you really don't have a particular platform where you can really get onto it and you can hook onto it. There are downsides to it. You are looking into technologies. You are developing new technologies, but the same technology is outdated within 6 months or probably a year down the line. So what do you do with that? There's no answer actually to it. You upgrade your technology and you forget that. Same thing which happens to your smartphones. Everybody is carrying a smartphone. Probably today somebody is on iPhone 14 and probably 6 months down the line he'll be on a 16 or an 18 or something like that. You have your Android systems also working up. But the problem, the biggest challenge for most of us is that how do we get up and stand onto these technology. Cybersecurity, what you were talking of, Inderjeet, is again a major threat to us. Like Inderjeet and the rest of the panel said that hacking of a system, we can do it with just one Bluetooth in one of your bulbs. So we have to be aware of what the technology, what is the downfall of technology, and how are we really going to cope up with those technology. You have smart cities all around the world now, and especially in India, we are propagating all these smart cities, based IoT based, AI based, virtual technology. So, but the flip side to it is that one small problem or one somebody decides to get into the system, your entire system comes to a halt. So that's what my point is.
Thank you, sir. And very importantly, the way the technology is changing, keeping pace with the technology is also a challenge. What you brought it out, but nevertheless, that we have to be upgraded and we have to be the best in the market as a facility manager, so that whatever is happening is the best in the organization. So over to you, Jeetendra. How are you doing it in the healthcare? Because that's the area which is always a point of concern, right?
So there are two parts to my answer. We are dealing with the previous question, right? So when we talk of safety in terms of medical equipment that we are going to procure, ROI is always not a concern. People do cost versus benefit analysis, and medical equipment, since they are made after a lot of research and development, it is not a problem. Desired results are achieved. But when we talk of the other equipment which aid to the safety and security of occupant, visitors, and patients, at times the technologies, they come costly, and when managers, they carry out cost versus benefit analysis, it is seen that the technologies are overpriced. I'll give you one example. Since Major Ashish pointed out about the COVID, in COVID-19, during the first wave, we heard about the thermal cameras, and some of the hospitals, they procured these cameras in order to achieve contactless screening of people. So a thermal camera with analytics and AI used to give the temperature of people coming into the facility. Now, concept was very good. It was executable, and there were two drawbacks. It was very costly, and second, the system, which worked pretty well during the February or March or maybe in April of 2020, didn't survive during the heat and summer of May, June, July. So, had these companies invested, let's say 10 lakh in procuring one camera, and if they have 2 or 3 access point, 30 lakhs, just imagine what would have been the ROI. And 1 year after that, when the second wave of COVID came, which was most devastating, consider the NCR scenario, those equipment were of no use. So think a little bit pragmatically, and always carry out a cost versus benefit analysis, and then go for a technology, because technology of today is actually going to be obsolete in next 5 years. Whereas medical technologies, I'm not talking, because iske bare mein pehle hi bata diya tha. But when we talk of the other technology which aid to the fire safety, security solutions and all, then you really have to see the efficacy versus cost.
Thank you. Very insightful. Yeah, over to you, Ashish.
I think there are two aspects which we need to be worried about. First is, like you all were mentioning about the cost. These new technologies, the cost is enormously high if you implement any integrated solution, because there is loads of softwares, hardwares, applications which are involved. And if you go to the maintenance of these systems, then I had read in many survey reports wherein the maintenance itself crosses almost 40% of the total cost of ownership. So I think being facility managers or being leaders, one of the solution in this could be that you have to have a very strong business case if you consider that the technology is required in your organization. And in order to have that business case, you need to convince the management by giving the relevant numbers and the value proposition which using that technology you're going to bring it to the organization. Now, there are two technologies which I still feel, although we're talking about AI, adaptive AI, and now metaverse and so on and so forth. And every 8 to 10 years, there is a change in the technology. After 10 years, there would be new technology which we may not have heard as of now. However, there are two technologies which are going to benefit us, especially from the perspective of security. One is the data analytics. Why I say so is that whatever amount of technology we may be using right now, we are sitting on loads of data and we do not know what to do with that. There are structured and unstructured data, and those data, people in marketing and business development in other areas, they're using it because if you use it effectively, these data is actually going to give you actionable insight, which you can use in your day-to-day functioning of facility management. The second is, like you were mentioning, specifically in the critical infrastructure. Critical infrastructure and the large, areas, large facilities, large enterprises, it is necessary that you have smart surveillance systems. And when you have these smart surveillance systems, they are loaded with 4K, varifocal, PTZ, etc. And majority of the images which we capture from the CCTV cameras, that is more than hundreds and hundreds of terabytes of data which we collect. So the technology which we need is the cloud solutions, because in times of today, when there is when we have already experienced the disruption by COVID, the cloud is the next solution to give the resilience to all the organizations. And I think these will continue even if there are constant changes in the technology.
Yeah, interestingly, data privacy of all this is very important. Just to give you an example, we go to all the buildings in Delhi, in Cyber Hub, they take your facial recognition photograph. Sometimes they also ask you some driving license or Aadhaar card at times. But have you ever noticed that where is the data going? Are they really supposed to collect it? Or they need to store it somewhere? And what is the life cycle of data? So those are the kind of things which facility managers have to really look in for. And that way they can be kind of very secure about what are they doing about the data. This is only a point to ponder. We can talk of this a lot. Now, the other aspect is like there are lots of crises which happen when I, as a facility manager, and having a proper SOP, having a proper SOP crisis plan is very important, right? So, what are the key considerations one, as a facility manager, one should have? So, your viewpoints on it, sir, and then Jeetendra.
See, that comes to the point of your emergency preparedness actually. How well are you prepared from an emergency point of view? What is your response? Actually, basically, why do you need an emergency response system? You need it only to mitigate the risk, whatever you're doing, whether it is in terms of data, whether in terms of workforce. We talk about workforce. Actually, after COVID-19, what has happened is you'll find many of organizations have cut down on the manpower. So your workforce is more or less now, it's on an on-demand sort of a workforce. You require it, you get it. If you don't require it, you don't get it. What also happens for a manpower is that you need to reskill and upskill yourselves also. This is a very important thing that we should also look into. Emergency preparedness, you need to prepare a plan, you need to go through the plan, you need to do some training on that, and you need to carry out your drills also. And you need to upgrade yourself, I think probably every 3 months. That's what it says. Even NDMA also says it, that you should have your drills in place, you should have your systems in place, you should have a process in place. How you are dealing with, what you are dealing with, whether you're dealing with a natural disaster or you're dealing with man-made disasters, fires, earthquakes, like you had just said right now, Chennai, submerged with floods. What do you do about it? So what is your plan for the emergency? How well are you prepared for it? Who all, is it top driven or bottom driven? So all those people need to be taken into confidence before we do all these things.
Yeah. Over to you, Jeetendra. Yeah.
Thank you. Healthcare facilities, they plan their emergencies manual depending on the guidelines that they have got from NABH and JCI, whichever accreditation they have got. NABH stands for National Accreditation Board for Healthcare Facilities, and the JCI stands for Joint Commission International, which is a USA-based body and considered to be a gold standard. Now, in the NCR, you'll find that most of the hospitals are NABH accredited, and they have that NABH logo on their signboard and cards, etc. Few of them, very small percentage, they are JCI accredited. Now, if we talk of JCI or NABH standard, they have over 1,300 standards, out of which around 250 standards are relating to facility management and safety. And out of that, 100 or 110 are related to the emergency management or emergency preparedness. Now just imagine that your GDAs, your housekeeper, your nurses, your managers, your doctors, these staffs are already overworked in patient care. Just imagine that they have to remember the emergency plans as per the standard and act. So in our experience, what we have done is we have kept the plan very simple. You write your emergency plans, keep it simple. There are 4 aspects to it. The first one is always keep it simple. Second, follow PITS model. So those of you who are not acquainted with the PITS model stands for plan, equip, train, and then exercise. In our city scenario, what happens? We exercise first, and then we go back to our plan. We try and equip ourselves, and then we do a final drill. So it should not be done. It should be done in plan, equip, train, and exercise. And the third part of it is you ensure that you do regular drills and exercises of these emergency plans. And when you're done with the drill exercises, ensure that you keep a record of it. Prepare a report. Keep it so that when you leave, you go to some other company, the next generation of managers, they have access to what you had done, right? People learn from the history.
That's very important. And the last point which you made was, the skilling, the training, and making people aware of what's there in the overall plan. Otherwise, you may have a paper plan, but when it's an emergency, you really need to, work on it. It will fail. So, thanks. Over to you, Ashish.
Yeah. In military again, there is one saying called the more you sweat in peace, the less you bleed in war. And it is very, very relevant here because, you guys have spoken about planning, which is very, very important because you have to have detailed planning, and of course it needs to be simple. But the most important aspect is rehearsal. And I know I have worked in corporate as well. I understand it's next to impossible to call people and carry out rehearsals. But come what may, now we have already learned the lessons. It is necessary that we prepare a rehearsal calendar. We identify all possible people or the stakeholders who are involved and carry out these rehearsals on regular basis. be it against the scenario of fire, be it against scenario of earthquake, be it against any scenario which even you can't think of. Nobody had thought of COVID. So there could be such scenarios where you have not even imagined black swan completely. But the rehearsal, if you constantly do that, believe me, at the time of the disaster, things are going to fail. But at least through constant rehearsal and planning, 80 or 90% of the time you'll succeed. You'll remember what needs to be done.
Thank you, and we are just coming to the close of the session. And wonderful points brought out by my panelist. And key takeaways is technology is going to be there, but you really need to think on it, which technology you require, and what's the obsolescence cycle of that technology itself. And what's the life cycle of this technology if you're taking a technology. So those things which you have to be very careful about it. Public safety is very important factor. You can't just take out of the mind. And whether it's a visitor security, your internal staff security, both the things are important. You are connected as a facilities. So you have a threat of cyber attacks anytime. And we've been talking of the critical infrastructure, and also the hospital I don't know whether if you're all aware that all the hospitals are now going to be part of the critical information infrastructure of the country. That means if there's a cyber attack, they have to have a plan in place. They have to have a cyber attack or the cyber threat framework to guard themselves up. This happened post AIMS cyber attack, which happened 23rd of November. They will stumbled upon, that we have put 6 organizations as critical infrastructure, namely your banking, your railways, your airports, your government offices and all, but they never put healthcare as part of the critical infrastructure. So now they're putting it up as a critical infrastructure. So that kind of facility, if you're maintaining, and even if you as a holding public infrastructure or government infrastructure, so those are all forming part of the critical infrastructure, right? So that is very important. You need to really safeguard them against the framework, and that comes as part of the National Cybersecurity Policy 2030. So those kind of things are there. And of course, not last but the least is the training, your awareness of the people. You may have the best plans in place, but as a facility manager, if you're not putting the plans to the right person and the last person is the organization, the complete plan goes for a toss. So with that, if somebody has any question, I think we'll take it on one question and then we'll wrap up. Sir.
I have one basic question, and I have a little experience on security. I'm talking security of people. Being fortunately, unfortunately, for 20 years on the board of directors, advisory board of Group 4, G4S, and we have faced this problem. All what you've said is excellent, first class, and we're doing very well. But my question is that I have a house where I put in all the systems, impregnable glass with sensors and so on and so forth, and somebody breaks it. What is the response time of a police van to come there? If you work it out, I think if I'm not mistaken, in England it's 4 minutes. The fellow doesn't come. The party is over. This is reality of our Indian conditions. So don't you think it's very important for all these management facilities really work at the ground level, day to day, for people? The police has to be involved thoroughly into it. There's no response time. I mean, look at it. I have a guard, Group 4 guard, I know of your management. There's a guard. He's got a stick or whatever it is. Now, if somebody comes, breaks it, and goes through with a knife, what does the housewife do? If you got all TV cameras, everything is fitted there. So it rings up 100. That fellow is sleeping most of the time. Or you say, what has happened? So by the time he comes back, so I think time has come to integrate with the police station, nearest police station, which they do world over. You know, you've been traveling, you know what it is. What are we going to do about that? It's very good on, God forbid, earthquakes and things like that doesn't happen. Then you're fully equipped in cyber, which you're very right. But what about the man on the street, day to day? Crime is going up because the interaction or the time of response is dismal. I think you gentlemen should look into that and interact with the agencies. That's my point. Thank you.
Sir, I do not know whether the answer is going to be apt or, just to add to what you said. I'll share my experience. So, one of the Gurgaon facility that Fortis Healthcare, had, it got opened up in, I think, 2011 or I think in the winters of 2012. And the biggest problem that we faced was the similar to what you just said. Out of a sudden, violence breaks out in the hospital, or somebody just walks in and starts fighting, or that kind of scenario. So we started our liaison with the police, local police, and we ensured that the beat. Delhi has a very effective beat system, beat patrolling system. But in Gurgaon, during those days, it was not prevalent. So we got the beat created, and the beat hut was made next to the hospital. So that way, we were able to get at least one police personnel deployed there round the clock. And during the hour of need, getting one person in the khaki worthy was quite a big help to us. And in turn, that policeman used to alert the police station and the local PCR. Whereas in last decade or so, it has evolved and it has become more responsive.
Sir, you
I
are,
hope this helps.
no, sir, you are a hospital. You can
I'll answer you, sir.
Please.
You're right. And it's the pinch of salt. We are primarily in a very reactive policing right now. And the crime rate are increasing, conviction rates are going down. We have to move from the reactive policing to the predictive policing, right? So that's the next stage of all these kind of crimes which can be, criminals can be nabbed, crime can be brought down. So that's the way forward. And for that, people have to be geared up. We are still in a erstwhile era of the dandas, so that has to move away and get into a different kind of mode to get into a predictive policing on ground.
Telephones, house telephones to the nearest police station is very easy to do. It's with this all technology which we have, it'll get comfort to the citizen. Response time will be very much good.
So I'll just tell you, I made an app. I'll share with everyone. I made an app called Safety App. It didn't pick up because in India we don't bother about safety. That app was like, you don't have to do anything. Anytime there's a crime which is happening, you just click a photograph and send it. Or if there is a distress, you shake the phone 4 times. It will go to the police. Now there's a problem of jurisdictions in Delhi itself. Like, who will be responsible for crime, right? Who will be taker of that particular complaint? And it was giving back the cops, the location, the exact photograph, the person who's reported. He can report anonymous also if he wants. So those kind of things, the kind of things which you're saying. So if there's a crime, if you have to just do a camera and just click it here and it goes, nothing else.
No, I
So
agree.
that is where we have to, and this is now, somebody took the idea, came on a blockchain. It's working in some of the colleges in US, where they have lots of crime rates which are very high, right? So the idea, we've got it. There were no takers here in India. Somebody picked up and they're working very well. So that's how it really works, sir.
So response time is the crux of the whole
Yes,
thing.
response time, reactive mode
Yeah,
of policing
absolutely.
to the predictive mode. If we are not going ahead, it's going to be very challenging for all of us in times to come.
I agree with you. Otherwise, all this gadgetry really to the common
Yes,
man is.
sir. You're 100% right. And
Like,
technology is the way forward
I agree.
for police also to react. for
Also,
these
the
kind of
man behind the
things.
machine,
Yes.
as they say, which is your police force.
So, in fact, just to tell you, the laws which are there in country, we are talking of the erstwhile IPCs, IT Act which came up, it's a redundant now. They think that it is no more, able to put criminals behind the bar. Now they are talking of something by the month of July. They are trying to come up with the act called Digital India Act 2023, looking in all the crimes of the present day.
Yeah.
And then we are talking of the cyber cops. Then also in times to come, there is something going to happen. Meta cops, the metaverse everybody's
Yes,
talking
I'm
of.
aware of
They're going to have meta cops in place. Interpol has already have meta cops in the metaverse.
Yes, I know.
And there'll be a meta laws which will come up by 2030, 28 or 30. So that's the kind of
Very
whole
good.
scenario the policing scenario is going to be.
Very good.
And the law scenario is going to be.
Thank you.
Thank you, sir.